Hi, my name is Andy Peralta, and I'm going to talk about drug-eluting stents or bare-metal stents for coronary artery disease. First, we have limited data are available on the long-term effects of contemporary drug-eluting stents versus contemporary bare-metal stents or rates of death, myocardial infarction, repeat revascularization, and stent thrombosis on the quality of life. Redundantly assigned 9,013 patients who had a stable or unstable coronary artery disease to undergo percutaneous coronary intervention, also known as PCI, with the implantation of either contemporary drug-eluting stents or bare-metal stents. In the group receiving drug-eluting stents, 96% of the patients received either everolimus or sotalolimus eluting stents. We have the second video.
Coronary artery disease. Coronary artery disease occurs when the coronary arteries are narrowed or blocked, reducing the amount of oxygen delivered to the heart. Two conditions, atherosclerosis and arteriosclerosis, commonly cause the narrowing or blockage of arteries. Atherosclerosis is a buildup of fatty deposits on the inner walls of arteries. This buildup causes a narrowing of the inner vessel diameter, restricting blood flow. Fats and other particles combine to form plaque. Arteriosclerosis is a stiffening or hardening of the artery wall resulting from calcium deposits. Often called hardening of the arteries, this condition causes the loss of elasticity, changing blood flow and increasing blood pressure. These conditions can facilitate rough surfaces, making them vulnerable to blockages. A large thrombus can cause an occlusion, or it may break loose to become an embolism and form blockages elsewhere. When blockage occurs, tissues may die, and in certain cases, this can be fixed.
Okay, now continuing. We have primary outcome was a composite of death from any cause and non-fatal spontaneous myocardial infarction after a median of 5 years of follow-up. Secondary outcomes included repeat revascularization, stent thrombosis, and quality of life. At 6 years, the rates of the primary outcome were 16.6% in the group receiving drug-eluting stents and 17.1% in the group receiving bare-metal stents. We have another video. Of coronary artery disease.
If we look through the chest wall, exposing the lungs and pericardium, which is the fibrous covering of the heart, we can see the heart actually beating inside the chest cavity. There's the left coronary artery up close, and the right one as well. They supply blood to specific regions of the heart. Damage to or blockage in either of these vessels can injure the wall of the heart. If we focus in on the left coronary artery, you can see the red blood cells traveling through it unimpeded. But if the inner wall of the coronary artery becomes damaged, cholesterol plaque can build up, progressively narrowing the available pathway through which blood can flow. Clotted blood attempting to traverse the blood vessel may find it tortuous and too narrow for passage, and the artery may become completely constricted or blocked off. The blocked artery results in a lack of oxygen or ischemia to the part of the heart muscle that the artery supplies.
Okay, continuing now. There were no significant between group differences in the components of the primary outcome. The 6-year rates of any repeat revascularization were 16.5% in the group receiving drug-eluting stents and 19.8% in the group receiving bare-metal stents. We have now another video. In patients with acute heart attacks using new generation drug-eluting stents more than the bare-metal stents. The Journal of the American Medical Association.
These tiny pieces of metal are called stents. They look relatively the same but are not. The one on the left is a bare-metal stent. The stent on the right releases medication after it is placed into a blocked coronary artery.
There has been controversy as to the use of drug-eluting stents, specifically in patients presenting with acute heart attack.
More than 10 years ago, the first drug-eluting stents released medication that would help keep the artery open through a durable polymer. However, the polymer stayed in the artery at the top of the stent.
There were concerns that actually these drug-eluting stents may lead to adverse events such as occlusion of the artery with blood clots.
Dr. Stefan Windecker from Bern University Hospital in Switzerland.
Okay, continuing. Now we have the quality of life measures did not differ significantly between the two groups. We have another video to show to you guys.
There hasn't been anything really new in bare-metal stent.
This is actually an advertisement of the new types of bare-metal stents. So we can continue. Now we have the conclusions. In patients undergoing PCI, there were no significant differences between those receiving drug-eluting stents and those receiving bare-metal stents in the composite outcome of death from any cause and non-fatal spontaneous myocardial infarction. Rates of repeat revascularization were lower in the group receiving drug-eluting stents. We have the last video of how the bare-metal stents are actually working in our body. More exactly in our arteries. Now, this is it. Thanks for watching, guys, and have a nice day. Bye.